8 stretches. Nobody does that solve 95% of your problems after 50. Don't ignore this or you'll regret it in 10 years. Before we get started, please leave a comment with your name and the city you're watching from. We would love to know. Stretch number 1, downward facing dog. After 50, morning stiffness stops being the exception and becomes the rule for most people. Downward facing dog is, without exaggeration, one of the most complete movements that exists because it simultaneously stretches the calves, hamstrings, and spinal erectors while also strengthening the shoulders isometrically. Regular practitioners can notice a perceptible reduction in back stiffness within the first few weeks of consistent practice. I have observed that a large portion of chronic lower back pain in people over 50 is related not to serious injuries but simply to a lack of mobility in the posterior chain, which gradually loses elasticity over the years if it is not regularly stimulated. Research in the field of physical therapy often points out that regular stretching involving hip flexion and spinal extension contributes to reducing episodes of nonspecific lower back pain, which is precisely the most common type of pain in this age group. To perform it correctly, place your hands and feet on the floor, shoulder width and hip width apart respectively, and push your hips up and back, forming an inverted V shape with your body. Your heels should reach toward the floor without necessarily touching it, and your neck should remain relaxed, looking in the direction of your feet. An extra tip to maximize the stretch is to gently bend one knee at a time in a pedaling motion, which helps gradually release the hamstrings without forcing them. A common mistake is to excessively round the thoracic spine while trying to straighten the legs at all costs, which shifts the focus away from the stretch and overloads the shoulders. Remember that the priority is always a straight spine, even if that means keeping the knees slightly bent at first. Start by holding the position for 20 to 30 seconds and, with practice, progress to 45 to 60 seconds, repeating 2 to 3 times. This stretch is contraindicated for people with untreated carpal tunnel syndrome, uncontrolled high blood pressure, or glaucoma, since the position of the head below the heart level may increase intraocular and intracranial pressure in those specific cases. An interesting fact is that, even though it is a simple movement to describe, downward facing dog is considered by many physical therapists to be a kind of thermometer for the body's overall mobility, since it demands flexibility and strength in several regions at the same time. If you find it very difficult to straighten your legs or bring your heels close to the floor, that is not a reason for discouragement. It is simply an indicator of where to start working. And if you will allow me a small confession, the first time I tried this pose, years ago, I looked more like a dog with a bad back than anything else, and that is perfectly fine. The process is exactly that, evolving little by little without comparing yourself to anyone else. Stretch number 2, child's pose. If downward-facing dog is energizing, child's pose is the complete opposite, an invitation to deep relaxation of the lower back, hips, and thighs. This stretch is especially valuable after 50 because it acts directly on accumulated tension in the lower back, a complaint present in a large portion of physical therapy offices serving this age group. What many people do not know is that child's pose also stimulates diaphragmatic breathing, since the position gently compresses the abdomen with each inhale, which helps activate the parasympathetic nervous system and reduce the stress accumulated throughout the day. To perform it, kneel on the floor, sit your glutes back onto your heels, and lean your torso forward, extending your arms out in front of you or leaving them relaxed alongside your body, with your forehead resting on the floor or on a pillow. Your knees can remain together or slightly apart, depending on each person's comfort level. An extra tip is to place a cushion between your heels and your glutes if you feel discomfort in the knees, which is quite common in this age group. A common mistake is to force the torso downward quickly without respecting the rhythm of the breath, which creates tension instead of relaxation. The instruction here is simple. Breathe in deeply and release the air slowly with each repetition, allowing the weight of the torso to naturally sink deeper with each exhale. Hold the position for 30 to 45 seconds initially, progressing to up to 90 seconds as the body adapts. This stretch is not recommended for people with a recent knee replacement, an untreated abdominal hernia, or women in the last trimester of pregnancy, situations in which pressure on the abdomen or knees may cause significant discomfort. It is worth noting that this pose is also an excellent way to close any stretching session, functioning almost like a reset button for the nervous system. Many people report that by including this pose before bed, they notice an improvement in sleep quality, likely due to the combination of muscle relaxation and slower, more controlled breathing. Stretch number 3, cat-cow. Cat-cow is probably the most underestimated movement on this list, and yet it is one of the most effective when it comes to spinal mobility. As we age, the intervertebral discs lose part of their natural hydration, and the only way to keep this region healthy is precisely by moving the spine through its full range of motion, something that the modern sedentary routine simply does not provide. The beauty of this exercise lies in its ability to work spinal flexion and extension in a safe and controlled way, with absolutely no impact on the joints. To perform it, position yourself on all fours, with your hands aligned under your shoulders and your knees aligned under your hips. As you inhale, let your belly drop toward the floor. Lift your chin and your tailbone, forming the cow pose. As you exhale, round your entire spine toward the ceiling, bringing your chin toward your chest, forming the cat pose. The movement should be slow and connected to the breath, never mechanical. An extra tip is to imagine that you are unrolling the spine one vertebra at a time with each transition, which considerably increases body awareness during the movement. A common mistake is to perform the movement too quickly, seeking quantity over quality, which drastically reduces the benefit for joint mobility. You will know you are doing it correctly when you feel each segment of the spine moving independently, rather than the entire torso shifting as one block. Start with 8 to 10 slow repetitions and progress to 15 to 20 repetitions as you gain mobility. People with a herniated disc in an acute phase or unstable spondylolisthesis should perform this movement only with professional clearance, as excessive range of motion may be uncomfortable in those cases. An analogy I often use is to imagine the spine as a chain with many links. If only some links move while others remain locked, the entire chain suffers from the imbalance, and that is exactly what happens when we neglect spinal mobility for years on end, constantly overloading the same segments while others remain completely still. Stretch number 4, bridge pose. Bridge pose is one of those movements that does two things at once. It stretches the front of the hip, including the hip flexors that become shortened from hours of sitting, while also activating the gluteus maximus, the largest muscle in the human body, something that 99% of people are unaware of. Neglecting the strengthening and mobility of this region after 50 is one of the biggest mistakes I see people make, because weakened glutes are directly linked to lower back pain and instability while walking, which increases the risk of falls. To perform it, lie on your back with your knees bent and your feet flat on the floor, close to your glutes and hip-width apart. Lift your hips toward the ceiling, squeezing your glutes at the top of the movement and lower back down in a controlled manner. An extra tip to maximize the stretch of the hip flexors is, at the top of the movement, to try to drive your hips slightly further forward, deepening the extension. A common mistake is to use the lower back to generate the movement instead of the glutes, which can cause discomfort in the lower back rather than strengthening it. Remember that the movement should originate from glute contraction, not from excessive arching of the spine. It is also worth highlighting that this stretch activates the core stabilizers isometrically, since the torso must remain aligned throughout the entire hold, which indirectly contributes to a firmer posture while walking. Hold for 3 to 5 seconds at the top and perform 10 to 12 repetitions, progressing to 15 repetitions as the body adapts. This movement is contraindicated for people with an untreated cervical injury or serious disc problems in the lower back, and it is important to seek professional guidance in those cases. Stretch number 5, supine spinal twist. If there is one stretch that tends to surprise people with its sensation of immediate relief, it is the supine spinal twist. It acts directly on the rotational mobility of the spine, a movement that practically disappears from our daily routine as we age, since we rarely rotate the torso fully in everyday activities. This loss of rotational mobility is one of the reasons so many people feel their spine is locked up when waking up or when trying to look behind them while driving, for example. To perform it, lie on your back, bend your knees, and bring them to one side, keeping your shoulders as flat against the floor as possible. Your arms extend out to the sides, forming a straight line with your shoulders, and your gaze can follow the direction opposite to your knees, slightly deepening the rotation in the cervical region, if that feels comfortable. An extra tip is to place a pillow between your knees to reduce tension in the hip joint during the twist. A common mistake is to force your shoulders to stay completely flat on the floor at all costs, which can create unnecessary compensations in the breathing pattern and unnecessary tension throughout the body. Breathe slowly and deeply throughout the entire movement, allowing each exhale to gently deepen the rotation. Hold for 30 seconds on each side, progressing to 60 seconds as you gain range of motion. This stretch should be avoided by people with a lumbar herniated disc in an acute phase or who have recently undergone spinal surgery, and medical clearance is necessary before practicing. What many people do not know is that weakened glutes are also related to what is known as the excess post-exercise oxygen consumption effect, that extra energy expenditure the body maintains even after physical activity has ended, precisely because it is the largest muscle in the human body and demands a great deal of energy to recover and remain active. Keeping this muscle group well trained, therefore, goes far beyond aesthetics and directly influences overall metabolic health. Stretch number 6. Cobra pose. Cobra pose works in a direction that most people completely neglect in their daily lives: spinal extension. We spend all our time curved forward, whether looking at our phones, driving, or sitting in front of a computer, and this creates a significant postural imbalance over the years. Cobra pose counterbalances precisely this pattern, stretching the abdominal region and strengthening the spinal erectors isometrically, while also opening the chest area, which also tends to shorten with a rounded posture maintained over decades. To perform it, lie face down with your hands flat on the floor near your ribcage and your elbows close to your body. Gently press the floor to lift your chest, keeping your hips and legs resting on the floor throughout the entire movement. An extra tip is to keep your shoulders away from your ears as you rise, avoiding the unnecessary tension in the cervical region that tends to appear when the movement is performed in a rush. A common mistake is to use only the strength of the arms to push the torso upward, which can excessively compress the lower back. The ideal approach is to lift the chest primarily through activation of the spinal erectors, using the arms only as complementary support. If you feel too much tension in the lower back when attempting the full version, a simpler alternative is to rest your forearms on the floor instead of your hands, reducing the intensity of the extension without losing the main benefit of the movement. Hold for 15 to 20 seconds and perform 3 to 4 repetitions, gradually progressing the hold time to 30 seconds. Cobra pose is contraindicated for pregnant women, people with carpal tunnel syndrome, a herniated disc in the lower back, or any recent spinal injury, situations in which extension may cause discomfort or worsen the condition. A detail that often goes unnoticed is that the spinal extension worked in Cobra pose also promotes expansion of the chest cavity, which can facilitate deeper breathing throughout the day, since a rounded posture tends to gently compress the lung region and limit full respiratory capacity. Stretch number 7. Piriformis stretch. Few people are familiar with the piriformis muscle, but it is directly related to one of the most common complaints after 50, the pain that radiates from the glute area down the back of the leg. This happens because the sciatic nerve passes very close to, and in some cases directly through, this small muscle located deep in the glute region. When the piriformis becomes tight or shortened, it can compress the sciatic nerve and generate a discomfort that is often mistaken for serious spinal problems, when in reality the source is this specific muscle. This shortening tends to worsen with prolonged periods of sitting, something quite common among people who have already retired and spend more time in armchairs or on sofas than they realize. To perform it, sit in a chair or on the floor, cross the ankle of one leg over the knee of the other, forming a figure 4 shape with your legs, and gently lean your torso slightly forward, keeping your spine straight. You will feel the stretch in the glute area of the crossed leg. An extra tip is, if you are on the floor, to use your hands to gently pull the lower leg toward your chest, deepening the stretch in a controlled way. A common mistake is to completely round the spine in an attempt to lean further forward, which shifts the focus away from the glute and unnecessarily transfers the tension to the lower back. Always keep your spine aligned and allow the stretch to happen through the tilt of the hips, not through the curvature of the back. Hold for 30 seconds on each side, progressing to 45 to 60 seconds as the body responds. This stretch should be performed with caution by people with a recent hip replacement or acute injuries in the hip joint, and professional guidance is recommended in those specific cases. Stretch number 8. Low lunge pose. Low lunge pose is a stretch traditionally used to open the hip flexors and the front of the thighs, an area that becomes extremely shortened in people who spend long hours sitting throughout their lives. This shortening, when accumulated over decades, is one of the silent causes of changes in posture and walking pattern after 50, since the hip stops extending fully with each step, overloading other joints such as the knees and lower back to compensate for this limitation. To perform it from a kneeling position, step one leg forward, forming an angle of approximately 90 degrees at the front knee, keeping the back knee resting on the floor. Gently tilt your hips forward, feeling the stretch in the front of the thigh and hip of the leg that remained behind. An extra tip is to gently squeeze the glute of the back leg during the stretch, which helps deepen the sensation in the hip flexor region more efficiently. A common mistake is to allow the front knee to travel too far past the line of the toes, which can create unnecessary stress on the joint. Remember to keep your spine upright throughout the entire movement, avoiding compensating with lower back curvature. Hold for 30 seconds on each side, progressing to 45 to 60 seconds as you gain range of motion. This stretch is not recommended for people with acute injuries in the supporting knee or serious balance issues without support, cases in which it is advisable to perform the movement close to a wall or chair for additional support. If you made it this far, you now have 8 simple but extremely powerful tools to restore mobility to your body after 50. The interesting thing is that none of these movements require equipment, a large space, or a lot of time. A few minutes a day, practiced consistently, are already enough to feel a difference in the way you move, get out of bed, and perform simple everyday tasks. If you enjoyed this and want to see the best isometric poses for you to do at home and strengthen the muscles of your legs, which are the largest muscles in the human body, we have a video appearing right now showing each one of them in greater detail. It is important knowledge for anyone who is already past 50, so make sure to check it out. Thank you for watching all the way through, and may God bless you, my friend.